Mine says starting.
Okay, we are live. First of all, I want to say thank you everyone for your patience. We had a few technical difficulties getting started. I'm not going to point fingers. But,
It was me.
no, I really appreciate everyone being here today. First of all, I just want to say welcome. My name is Jamie Adkins. I'm the Director of Business Development at MedShift. And again, thank you for joining us for our second presentation of the year on semaglutide, and specifically our new oral sublingual semaglutide. So I'll start by saying that I am sure all of you are aware that in the past few years, the rise of semaglutide has taken the weight loss industry by storm. It evolved from manufactured prescriptions designed for type 2 diabetics to now dedicated weight loss medications intended to help patients not only lose weight, but improve their overall health. And these medications, I can speak personally, have been so effective and impactful that they've not only transformed the weight loss industry, but they've changed the surgical industry as well, as many patients are opting to lose weight without invasive procedures. And I think we can all say how we've seen the entire medical industry, aesthetic medical industry, that's been impacted dramatically by this as well. So it's exciting to see that many patients are now looking to their trusted nurses and doctors, you all who run medical spas and aesthetic medical practices, to understand and prescribe semaglutide to improve their quality of life. So that is why we're here today. And at MedShift, you all know that we're committed to sourcing the best products and services and programs for our customers. And given the fact that there's been such a boom in this category, and we continue to receive a lot of questions about it from our customers, we spent months researching semaglutide and effective weight loss programs. And so we're thrilled. We think we found an extremely effective option for our practices that is uniquely different from most of the medications that you see on the market today. So with that said, I'm going to let our special guest do more of the talking for the day on semaglutide, but I would like to introduce Bridget Williamson. And you can see here we've got a brief agenda where she's going to be talking today about oral semaglutide, a little bit on the clinical side, but then diving really deeper into the business of semaglutide and how to incorporate it into your practice successfully. So Bridget is one of our favorite people to work with. She's a physician, she's a Master of Physician Assistant Studies from Butler University, and she's got a background in organic chemistry. And I would say that Bridget has a very unique background in that she spent the first 10 years of her career working in big pharma and eventually decided to change her career to become a nurse at the age of 30. And since then, she's done elective rotations in cosmetic surgery and hospital medicine. And now she's an expert injector trainer and aesthetic business owner. And in addition to leading private trainings for practices, she also leads MedShift's monthly injectors trainings for the face and body. We do that out here in Charlotte at our headquarters. And today she's here to lend her clinical expertise with semaglutide. And again, as I mentioned, she's going to share her tricks of the trade to implementing and selling a successful semaglutide weight loss program in your practice. So before we begin, I have two things that I want to say, just kind of housekeeping items. If you do have questions, please look to the right of your screen. There should be a chat box there. You can type them in as Bridget's talking. She's going to get to those at the very end of the presentation during our live Q&A. And then also, I want to encourage everyone on the line to participate in our poll. If you haven't clicked on the poll and given us your answer, we would love to know which of you already offer semaglutide for weight loss in your practice. And I see here, it's pretty exciting. 50% of you are already saying yes, but injectables only. And I love seeing there's 10% of you that offer a couple options, injectables and oral. And surprisingly, we've got 40% who are saying no. So welcome if this is your first time you're being exposed to semaglutide. And I can see the numbers are changing. I'm going to leave that poll up in case anybody wants to weigh in. But with that said, and without further ado, I'll turn it over to Bridget Williamson.
Thank you, Jamie. I appreciate it. I will tell you, weight loss is something that's very near and dear to my heart. So I was extremely excited when MedShift brought this on. I've been working with MedShift for 3 years now, and they're really cutting edge. And so when they were able to get an oral semaglutide, I thought to myself, like, I didn't even really realize that was a thing. And I've been prescribing semaglutide for 3 years. And I've been doing weight loss actually for over 10 years. I did the other GLP-1s like the Saxenda liraglutide, and now I've started with tirzepatide. But there's never been a GLP-1 that I really had used orally until MedShift brought it up. So I feel like this really kind of bridges that gap between the people that are used to weight loss medicines like the old way, you know, so the Contraves or the Adipexes, the diethylpropions, whatever, to bridge the gap from that to the needle was a little bit harder, but we did it. And I think it was actually made easier because of all the publicity. And you'll see we have some great data about weight loss in the slides. And it's kind of amazing because obesity has been such a problem for so long, but with the advent of the GLP-1, so adding the GLP-1 agonist to our arsenal, weight loss has doubled. You know, the people that are doing it, the people that are losing it. We used to get about 3% efficacy with a 3% body weight reduction in 3 months. That's really the typical standard for like the Adipexes and stuff. And now we're over 10%. So, you know, for that reason, the industry has doubled in size. And I think it's amazing because, you know, taking care of your health, I've always had a problem. If you do prescribe, you know, weight loss medicine, you know, a lot of pharmacies won't cover it or insurance won't cover it. And they say, this is cosmetic. This is not a medical issue. And I have to disagree. I think most people would. There's so many medical issues that start because of obesity or somebody being overweight, but also that are just made worse. And then when you lose weight, a lot of these people can go off of medications, the people that had comorbidities, we call it, from, you know, being overweight. So to me, I think it's amazing that we have this available. I love that it's kind of become viral, and it's become this boom with the Ozempic and the Wegovy's. But also what's really important is that now, you know, if you've been around for a few years, you saw they took away some of the weight loss indications on the name brand pharmaceuticals. But now that we have the compounding pharmacy, it's much more doable and it's affordable. It's not really just, you know, the wealthier upper class that can afford to do it now. And so now that we have a pill form as well, we're able to tackle the entire market. So those are the people that maybe were afraid of side effects, that are just afraid of needles. If you're in aesthetics, you know those people, they're going to pass out in your chair every time. But now we have a pill form. So the fact that MedShift brought this on first, I absolutely love it. And so I'm extremely excited to be able to talk about that today with you guys. I love also that half of us really haven't even done much weight loss. And I'm happy. I've been doing weight loss since 2014. I'm happy to talk to anybody offline about it also. But, you know, this program will be more about the oral semaglutide and adding it to our practice. Okay, so what makes it, oops, did I skip a slide? I don't know what I did. Sorry, I'm going to push a button. Let me push one more button. Now I'm going to get in trouble with Jamie. Mine are not showing up. I'm going to use them on my phone. Okay, so somebody has control. Good. I just do not see that slide. So I'm going to open it just so I have a backup copy of the slides and I can talk to them as you guys see them, I think. Okay, so semaglutide is indicated for the treatment of obesity and for chronic weight management. So that means it's FDA approved, you know, for the treatment of obesity. Also, people with comorbidities with the BMI over 27, which is not quite obese, it's overweight but not obese. They with comorbidities will also fall into the category of people that are good. There we go. Our slides are, I think they're finally catching up. So anyway, people that are good candidates for a weight loss medication. The GLP-1 receptor agonists, if you don't know much about it, they work in a really amazing way. So like initially it does slow gastric emptying. So people that tend to eat because they're hungry or have trouble with diets because they get so hungry, this takes away that little piece. And honestly, if you've never done a weight loss medicine or you've never had an issue with it, that's the hardest part because, you know, just like when you feel overweight or you feel like you're having a bad hair day or you didn't put on makeup, you're kind of self-conscious all day. I feel the same way about weight. When you have a holiday or whatever, and you feel like you've gained 10 pounds or you just had a baby, you feel like people see it because it doesn't feel right to you. you feel like people kind of view you that way as a person that's overweight. So I think it's extremely important that you feel good and that you feel confident at the size that you want to be. And so for some people, you know, that goal weight is always going to be a moving target, or it's going to be something that it's really personal. So it's important that we ask about that. But because now people are feeling full, the diet isn't something they think about all day, you know, because they're not thinking about hunger or having hunger pains. It's easier to go about your day. And, you know, I don't know how many of you have actually taken the medication, but I'll tell you, since I've been doing weight loss for 10 years, you know, I've taken a lot of them, and it's really amazing. And the other really nice part about this is it actually reduces cravings. So by your body feeling full, hunger is what starts cravings, right? The serotonin things are getting released and you start feeling cravings. This actually reduces cravings. And anecdotally, I'm going to say that a lot because a lot of the information I have is from having so many people on weight loss programs and medications. But anecdotally, I've had people say not only are their cravings reduced for like sugars or food or, you know, whatever salty, they are finding they don't feel like smoking as much, or they don't feel like drinking as much alcohol. So it's just cravings in general. So overall, nobody has complained about that. Everybody loves that. You know, it's a really nice side effect of the GLP-1 receptor agonist. But because of those two things, now that you don't feel hungry and you don't have those cravings, even, you know, the cravings that you get when you're not really hungry, but it's like, oh, it's 10 o'clock. I always eat popcorn with a few, you know, Hershey bars or whatever. Getting rid of that makes life so much easier. And honestly, if you've been doing this a while, you know that the first few weeks are the hardest. If you can get compliance in the first few weeks and people can see a result, then they're going to be all in. But if people feel like they're struggling and, you know, feel like, well, I haven't eaten in a week and I haven't lost any weight, they kind of abort. You know, it's harder to keep people compliant. So a medication like this, now that we've got these GLP-1s and we're getting those really quick results, people are actually doing better because they're actually more motivated. You know, this is a population that we're able to target that has felt hopeless their entire life. They have, and if you do it, you probably will agree with me, but they have tried many things. They feel like they've tried many things. They feel like they did their best. You know, they did the MyFitnessPals and the Weight Watchers and the keto or the calorie counting, the macros, and eventually it didn't work, you know, and that's why we meet them, right? They come to us for this kind of help. And so these new medications really, I hate and love that they're everywhere, because obviously I think they make us very successful. But the fact that they're everywhere and they're still in demand and the industry is still, you know, exponentially growing is great news for all of us. But now that we have the ability to add the oral version, we have completely closed that gap. You know, now we can medicate people with whatever works best for them. So it's very nice. Sublingual medications also. So these are troches. It's a sublingual medication, meaning you'll let it dissolve under your tongue. This also bypasses all of that first pass metabolism. So it doesn't go through the GI tract. It's not going through the liver and all that. So it goes straight into the bloodstream. A lot of people kind of like that. They feel like it's less complicating or whatever, not having to go through the GI tract. My slides still aren't showing up, so I'm reading them on my phone, but I'm going to go to the next slide with the proven results. I hope you guys can see them. So proven results, like I said, I kind of touched on this earlier, but the average weight loss is 10.9%. If you've been doing all the other weight loss methods prior to these GLP-1 agonists, they were closer to 3%. We considered 3% success, 3% body weight over the first 3 months. So this is pretty impressive. We're getting 10.9% over 6 months. And I do reference 3 months a lot, and you'll kind of see this the way it's packaged in many, many places. I reference that because, you know, your body has a set point. If you've ever been overweight, you know that kind of that's where your body tends to want to go back to. So if you're at 200, you might get to 210, but you're going to settle down. You might get to 190, but you're going to settle down. That's your set point. For the body's set point to actually reset, it needs to stay there for about 90 days. And so that's why when I do weight loss or when I talk about it, I always talk about the 3 months. Those 3 months are important. You know, even if it's somebody that gets to their goal weight at the end of 2 months, for example, you know, say somebody gung-ho lost all that they needed to in the first 2 months, I still encourage that compliance with the 3 months because we do not want them to gain it back. So that's one tidbit that I want to add in. And I've seen so much of this anecdotally, just in my own client population. I feel like it's pretty fascinating that if you can coach your clients on how other clients do, and the more experience you get, the better you're at, controlling them. And it's so hard because you think, I'm not there. This patient's saying, something, this side effect, and you have to really tease out how big of a deal it is or how important, or, because that's the only way you know what to kind of advise them to change. So as you get more experience with these GLP-1s and all the weight loss, I think you're able to help all of your clients even better. It's pretty neat. It's the way that it kind of spirals into this very successful program. You know, a lot of people, the people that were extremely obese, they did feel hopeless, and they were feeling like they had to go to bariatric surgery or something that's, you know, quite drastic. And honestly, in an obese population or overweight population, that's much higher risk than it is in a regular healthy population. So when we have something like this that can cause this much difference and actually reduce the time that, or I guess the number of people that feel like they have to go to bariatric surgery, it's, you know, we're helping so many people by doing it, and we're making it affordable because now we don't even have to worry about insurance denying it, you know? So when comparing, okay, let's go into the blue box. The oral semaglutide helps patients feel satiated by lowering blood sugar. Now, I will tell you, a lot of people say, you know, I'm not diabetic. I don't want my blood sugar to go too low. The beautiful thing about this, it'll never send you to lows, you know, so it's sort of like certain blood pressure medicines. When you know, worry about somebody's blood pressure, you need to catch one that isn't going to cause hypotension in a certain population. This won't cause low blood sugar in a normal person that doesn't have diabetes or insulin resistance. Also, it's going to reduce cravings, but slowing the digestion. I love this slide, because this says without semaglutide, the average time that your stomach will feel full is 20 minutes. You know, we tell people we'll eat slower, you know, to kind of prolong that period. With semaglutide, we're getting over 5 times longer, 120 minutes, you know, so that's hours, right? And so if you think about it, when you're hungry and you're not feeling full very long, it's going to become a cycle, this like snacking and munching, etc. If your stomach is staying full for hours, you get on with it. You know, you're not going to sit in that. I call it like a cycle. You have these cycles where your brain is like, I want an M&M, I want an M&M, I want an M&M, and you can't get off of it until you get the M&M, and then the M&M makes you want another M&M. When you feel full, that cycle, it goes away. You're like, you know what? And if you've done it before, you probably have, you know, had patients say, you know, it was a little bit, I never imagined I'd feel full that long. Or, you know, they might say they felt a little bit bloated at first because they're just not used to this feeling. You know, it's pretty amazing to be able to slow digestion like that. So that's just proving that this nice natural way of weight loss, it's not like a drug that's like a stimulant that's going to, you know, cause all these side effects of like anxiety and high heart rate or anything like that. All it's doing is slowing down what we already do. It's making our body do what it's meant to do, which is to absorb the nutrients in the food, stay full, you know, eat regular sized portions and regular meals. You know, you won't be able to like overeat at a 2-hour dinner like you used to, you know, or like on vacation. Although I've had some patients say, I'm going on vacation, I don't know if I want to take it. And it's like, just trust me on this, take it. You're never going to feel like you were cheated out of your, you know, ice cream. You still got it, and you'll be proud of yourself that you maybe only ate 1 scoop out of the 2 that you ordered or normally order. Okay, and so what other advantages about the oral sublingual semaglutide? There's several things. Number one, if you've been dealing with this, and if you started weight loss and you get people coming from their PCP, you know, they're saying, well, I used to be able to get Wegovy or Ozempic. My insurance copay was only $35, and now they want $1,000 or $1,200. Tirzepatide, all of that. I get so many clients, and you know, this is unfortunate and very sad. So many clients that come to me and they say, well, I did it for 6 months and now I've been cut off, or not cut off, but the price, you know, my coupon doesn't work, or my doctor said I can't have it anymore, especially, you know, when they took the label indication away. Now that's, you know, I feel like that's almost a disservice, right? We get somebody started, we get them excited, and then we take that away. Well, now we've got that available. And I have a lot of people that actually said they're approved, but you know, Ozempic is on back order and they can't get it. Oral semaglutide we can get right away. Our pharmacy is shipping it in 2nd-day mail, so 2-day mail. So that's really nice. Also, for people that are afraid of injections, they don't have to worry about it. They don't have to worry about the sharps. I have a lot of people, not me, of course, I love my needles, but I have a lot of people that they ask these questions, and I realize like, oh my gosh, like the fear of a needle in the house has, you know, I think we take for granted that it's not normal. It's not normal that, you know, people have needles laying around in sharps containers under their sinks or anything like that. So it really is a big education thing to get people started. I think one of the biggest pitfalls I had was assuming that, you know, it's not that big of a deal to have a needle. Well, it actually is. And so being able to tell people, well, now we have options. You can do it. We just want to find out what fits your lifestyle best. Is it going to be the needle or is it going to be oral? So it's nice. And like we also said earlier, getting people to avoid surgery by 10% weight loss in the first 3 to 6 months is impressive, right? So let's go to the next slide. I don't want to touch any buttons. Okay, it worked. Okay, so the oral semaglutide, I will tell you, if you've been doing the injectable, which over half of you have been, the injectable is a dose titration that goes month by month. And a lot of people do this differently than the original. So, and I do too. I don't do it the exact same way, but the doses can be increased as soon as the first month. But also it's a shot that they'll do any time of day with or without a full stomach, but it's a little subcutaneous injection into a fat. So you pinch the belly, alcohol swab, get your needle, inject it once a week. The medication, the injectable medication needs to stay refrigerated. So a lot of people feel like they can't take it if they're out of town. So this could be a problem for people that travel, but also people that work out of town a lot for a living. It's going to be hard to necessarily carry those needles. So oral semaglutide might be a great option for somebody who doesn't always have access to a refrigerator, is traveling. A lot of people I've heard have children at home, and so they put it in a lockbox in their garage, fridge or something. They feel uncomfortable keeping an injection or a needle or whatever in the fridge where there's children, and I completely understand and agree. Well, these troches actually bypass all of that problem, right? Now it's just a regular medication on your counter. You can take it when you travel. Obviously it's your prescription. You want to keep it in the prescription bottle, but you're not going to have any of these questions about like, what is this? A lot of people doing the injectable semaglutide, myself included, are sending the vial, and I'm letting people draw it up and inject it, themselves. So when they're traveling with it, I don't know what they're traveling with necessarily, right? If they didn't tell me or ask me how to travel with it, I don't know. So this does make, that piece of the program much easier. And, most people do know somebody who's going to travel in the next three months, which really we want people to do at least 3 months on weight loss medications, which is kind of what I said earlier. So it's going to dissolve sublingually. So the people that have like a lot of side effects and are worried about taking a medicine that's going to sit in their bloodstream for a whole week, maybe this is a great way to start. This way, I have a lot of people that say, I'm sensitive to medications, I can't take this, or I get a paradoxical effect. These are the people that make me nervous, right? Because I'm like, oh, this is going to be a real hand holder, or I need to put on my kid gloves with this one, or make sure I'm not breezing by something that I'm taking for granted is easy, like a needle, and make sure I really hold that hand. This oral gives me so much, more leeway. Like with those people, I feel a lot safer giving it to them. I say, okay, you're not going to swallow it. You're going to let it dissolve under your tongue. You're going to do it once a day. Do it first thing in the morning or whatever. Again, it's really similar to the injectable, but I think its profile, it's just as effective, but now we have more people that we can treat, so I do love that. But also the people that you're nervous about, we can offer them a 1 month if they're nervous about how the side effects, because I know a lot of people when this first came out, I don't think it's as big of a deal now because we have so many more people with experience. But when it first came out, people were like, oh, I heard that'll make you sick, or I don't know. I have all the time. I have people that are like, well, I don't want to start it till Friday because I have a big work thing going on and I'm worried about being sick, and I do feel like I'm able to start people on the medication that, I say be conscientious of your side effects, but when I start them on it, I start them and make sure, they know how to contact me if they do have side effects. And I haven't had really any big issues with anybody saying I've had to miss work or I felt terrible for the first week. But those people that are afraid of that, and then afraid once you've taken that shot, it's going to take all week to wear off. Well, not wear off, but it's active in your body for an entire week. These people would be a great person to try the pill or the troche first, And right now there's absolutely no shortages. The compounding pharmacies are doing a great job, but if you've been doing it a few years, you've had months where you're like, it's hard to make money when I can't get my products, but also you don't want somebody that started on a medication, not able to get it, right? We don't want them gaining weight back, but we also don't want them to start feeling, let down, or despondent, or like they're hopeless again, because this is finally hope for people that have felt hopeless. And I know I'm not the only one that would agree, especially if you've been doing weight loss. It looks like now almost 2/3 of our people do weight loss. Anyway, also the cost. When we go through compounding pharmacies, we're able to avoid the big pharma cost, and I'm not sure how it all unfolded. I know last year I had so many people tell me about all these, lawsuits and stuff. But the truth is it's completely legal. The pharmacies are safe. Whatever compounding pharmacy you're using, they'll tell you exactly what, I have had people that are very educated or they watch too much news, but they've come to me and said, is this the salt? Is this? So I'm like, okay, you know what you're doing. So our pharmacy will, happily share all that information with you and your clients, your patients as well. But about the cost, like I said, now we're able to offer it to everybody, and I don't know if all of you take insurance or not, but a lot of people just don't. We're med spas. We're not used to charging or billing insurance. If you're in derm or something else like that, possibly, but you're probably not doing weight loss. So if this is like a true med spa thing where you're not used to insurance, you're not used to all that stuff and having to, fly by CMS guidelines to bill United or whatever, everybody has access to this, and it doesn't matter. It's the same price for everybody. But we're saving so much money, even the people that had the coupon card and stuff like that, because they're not paying for PCP visits they used to have to pay for, etc. Okay, let's go to the next slide. Okay, that's same slide. No, I think there might be a delay. I'm going to open mine again just so I can keep going, because I do get really excited about this, but I could talk about it forever. Okay, so you have the patient base. This is a really interesting statistic. If you look in the slide, in 2021, the market was a $224 billion industry, right? And they're expecting it to be $405 billion, so a double, 2 times growth by 2030. That's huge. That's huge. I think it's exciting, but I can't wait to see kind of what the landscape looks like when we have that many people that are at a healthier weight compared to where we've been. Like we said earlier, weight loss used to be something based on status or what kind of access you had. Now it's not necessarily like that. We can afford to get a lot of people on the oral semaglutide. So the good news, if you've already got the patient base, which you do, this fits in really well. People that care about their appearance are going to start with, it might be their Botox and fillers, but then they realize you've got weight loss, but also vice versa. And I have always said, and I've maintained this from the day I started my med spa business, if you have clients, you want to keep them, because if there's certain services, if you're only offering like 50%, when I train on toxin injection all the time. I say, you can start offering toxin, but if you're not offering fillers, they might start getting their toxin where they get their fillers. And so you're not going to retain them. This is another way to help us retain our clients by offering the weight loss solutions. Let's go to the next slide. Okay, how can you incorporate it? Now, this is something that MedShift helps you with a lot. We do have a starter kit that I think is actually in the offers button. I'm not really going to go into that. I'm going to let Jamie help with that. But the starter kit's a great way to get started, because honestly, as soon as you buy that starter kit, and it's under $1,000. As soon as you buy that starter kit, you have access to this digital content, and you can start your online pharmacy account. So once you start that account, as soon as you have patients, you can start prescribing really quickly. It is important that, obviously, just like with any medication, you educate people. This does have a dose escalation. You will start at a 0.5 milligram troche for the first 60 days. So a little bit different than the injectable, but then you're going to switch to 1 milligram troche. And we do sell it at MedShift in the 90-day sets, but also a 30-day. So if, I don't like people to commit to me for 30 days, but if I have somebody that's extremely scared of side effects or, just wants to make sure, I absolutely do let them try 30 days, but I make sure I explain that this really should be something they do longer than 30 days. I am a firm believer that you can't lose all the weight you want in 30 days and keep it off. 90, much better, you get a much better head start. And also it's just about, establishing habits. Habits, they say, take 42 days to establish. So that's more than 30. If you do something for 30 days and quit, you may not be as successful as if you had done it for 90. Okay, so let's go to the next slide. Okay, so the most important part, and this is true of anything, as you guys know, is to make sure your clients are educated. And that's why MedShift's made this really nice starter guide that you can share with your clients. You can advertise it in your office, and it answers a lot of the questions that the patients are going to have. And it's also going to help you get started. Because it's kind of giving you the tools to advertise what you need to advertise. And really, if you bought the starter kit, once you have that, it's beautiful material too, if you haven't seen it. Once you have that, you're ready to advertise it on social media. Make sure obviously that you're an educated prescriber and provider, and that you know all the contraindications to the medication, although there are extremely few. You want to make sure you're obviously prescribing it extremely safely. It's already, and I think let's go to the next slide. I can't see our slides for some reason. I don't know why I'm on a delay, but it's already being talked about. I don't even have to say anything about this slide. It's true. Everybody knows it's being talked about. but adding the oral is going to separate you from all of these ads. I don't even follow a lot of med spas on all of my Instagram accounts, but some of them, the weight loss pops up everywhere. It's not even, it's my normal stuff. Weight loss semaglutide. I see it on TV. I see it on banners on Google ads, etc. These people are offering injectables. If you can start adding the oral, it's going to just really increase your spread and your scope. And so that's one of the things I really like about it. The truth is, though, because it's so well known in the industry, it's making our job so much easier. I do tend to, I make videos, or, I have like a YouTube channel where I'll make a quick video. So if somebody texts me or, sends a quick thing, I'd like more information, I just send a link to the video, and it's basically just 5 minutes of me talking about it. But I know it's going to answer a lot of questions, and it's not going to be, I need to set aside a phone call for every single patient to answer questions for 20 minutes when I can just send them that link to the video. I kind of liken the marketing materials that MedShift is providing to that. So we want to make sure that we set them up for success. We've educated them. We know they're a good candidate. All these materials are going to help you with that. And then we want to make sure that it's affordable. So the one question is, how much does it cost? It's right on par with the injectable, which I do like, because I don't like people to choose a product because of the price. I like them to choose it because it's the best one, or because it's something that I decided with them. Same, if you do aesthetics, if they're asking for under eye filler and you think it's a cheek, you want to have that conversation. I feel the same way about the weight loss program. So if you think about the pricing, we're recommending you could price it at about $500 to $600 per month, which is what most people are doing with the injectable. The injectable brand name's up to $1,000 per month. And so really you can keep it on par. If you order the medication in 3 month supplies, which I've told you several times now why I recommend, the price is cut. You do get a price break. So that's nice. And the pharmacy will ship it straight to them. And they actually ship it with the right dose for the dose escalation. Like I told you, we might change dose after the first 2 months. You can double it or increase to the milligram. So that's all sent as the whole ramping package. You can send your patient this entire package with the ramping instructions, et cetera, straight from the pharmacy to their house. So that's nice. And we're not having any delays. Like right now, I hate to say never, because there's always like a lidocaine issue that you're like, how did that even happen? So anyways, we're able to get it really quickly. So the next slide is super easy. This is how it works. If you haven't been on the MedShift store, so now I'm on the old slide. But anyway, if you haven't been on the MedShift store, it's easy. You go online, you order your starter kit. Within seconds, you will get an email that says, thank you for ordering. If you have questions, reach out here. Here's your digital packet. Here's what you need to do to get started. Here's the pharmacy, and it just walks you through it. And I did this as a test, before I even knew anything about it. It's pretty neat. It's automated, and MedShift works straight through with the pharmacy so that they'll start getting you set up. You don't have to worry about giving them your credit card or anything like that. And once you're set up to e-prescribe, you can add as many patients at a time as you want, and you'll just go straight through the MedShift store, and it's already paid for. It comes straight out of your account. Submit the prescription, and then it goes to the patient. So it's extremely easy. Probably like if you're using compounding pharmacies now, it's a similar process, except for now we've given you this starter kit. So we feel like it's safer to go in a little bit more educated. I hope everybody agrees with that. And the starter kit really does help, but also we're available to help you. And I personally, I like to tell people I'm extremely approachable. I think I am. I hope so. But anyway, I'm happy to share my email and my phone number with you if you have questions that we can follow up with after this, because I know a lot of people are new to the entire weight loss realm, and some people are only new to the oral semaglutide realm. So I'm happy to answer questions. I know we're kind of running out of time. So I did want to or do we have one more slide, Jamie? Yeah. Okay. There we go. We are ready for Q&As. So
okay.
Sorry for being clumsy with the slides. I don't know why I couldn't see them all, but thank you.
No, that's okay, Bridget. Thank you so much. Great, great content, great education there. I know we have some eager folks who asked some questions in the chat. So I'm going to go through these. And Bridget, I know some of these were more for our pharmacist, and I actually have him kind of on standby. So he's answered some of these questions that I can certainly help with as well. The first was for Megan. Do you have the study that was published regarding sublingual semaglutide and weight loss results? And I can say on MedShift's behalf that we do have that study. So Megan, we'll make a point to get that out to you after the event today, so that you have that in hand. And if anybody else would like those that study as well, and where we got some of our data, we're certainly happy to send that out. The second question is, how do the side effects compare with injectable semaglutide?
In my experience, I would say the side effects are really the same. It's the same drug. It's just a different delivery. So you need to expect the same thing because of delayed gastric emptying. If you go back, that's our number one main mechanism of action. Because of that, side effects can include a feeling of bloatedness, a feeling of nausea. People that tend to get acid reflux will notice it far more, and it's basically, I think of it as food in the stomach. What does food sitting in the stomach do? So anytime you've had a GI bug, something like that, it's that feeling of kind of just a little bit of bloat. That's what I love about the pill though, right? If anybody is super afraid of side effects and I'm worried, about the whole hand holding process, just start with the pill. You can always go back. You can always switch. None of these have like a discontinuation or anything like that. So the pill it's a very nice option for that kind of thing. I will tell you though, the side effects still are, possible and real. And for that reason, I always coach people, if you're sending them home with medication, do not increase dose without me telling you. People like to tell me, oh, my 3 months is up, blah, blah, blah. I'm like, we should talk about this every month. Don't increase dose on your own. Honestly, the more that you increase the dose, the quicker you're going to get a tolerance, right? The reason for increasing dose is so that the tolerance, because you get a little bit of tolerance, it stops working as well. And you increase dose to avoid that plateau. So you don't want to increase dose too early because you're just increasing your tolerance, right? And your drug cost. That's a good question.
Yeah, we've got a bunch more. So the next one was from Catherine. Is it still as effective as the injectable kind?
It sure is. 10.9% body weight.
Yep. And I would agree with that.
That's in the study. So, and Jamie's going to send out the study.
Yes, definitely. And then next question for Megan again, is this indicated for more of a maintenance, or why is the dosing different than Rybelsus? I can actually answer that. Our pharmacist weighed in on that. And Bridget, if you have anything to add as well, please feel free. He mentioned that Rybelsus is swallowed, so you lose a lot of medication in the stomach. And he said we can dose orally dissolving lower because it's getting absorbed in the mouth and going directly into the bloodstream. So that's why you do see that variation in dosing and why it's not exactly the same as Rybelsus.
But we can also use it for maintenance.
There you go. You can, and that's why there's different variations in dosing as well. If a patient finished 6 months with semaglutide with a 2 milligram dosage, with what dosage will the patient start with sublingual semaglutide? That's another great question. Bridget, do you have any insight there? This might be one I could. Go ahead.
What I would recommend is start with the 1 milligram, as long as there's no break. Honestly, if you get a break, then you really want to start slower and smaller. This is anecdotal and just true. If the patient has been off of medication, which I do get this, they're like, oh, I lost my Mounjaro, I lost my semaglutide, copay or whatever. I'm like, how long have you been off of it? You don't want to go straight. You don't want to go pick up where I did it last year and I was up to 40 units. Should I start at 40? No, you're going to start back from scratch, because we do not want to go through crazy side effects that we don't have to. So as long as they are going straight from injectable to oral, yes, go to the 1 milligram. If not, if they've had a month break or more, I'd start them at the half. And honestly, makes me more comfortable.
Yeah. And going back to one of the questions before about how effective this is, or comparing it to the injectable kind, I just want to reassure everybody, we work with a 503B. So if anybody knows a little bit about pharmacies, 503As and 503Bs, 503A is typically, they're your pharmacy that's going to be doing patient-specific prescriptions. A 503B is held to completely different standards. So they must validate every manufacturing process under the CGMP guidelines. So it's regulated and monitored by the FDA. It's enforced by the FDA. So it is just as efficacious as the injectable kind, and that's one of the reasons why we selected it as well. Oh, we've got another question that just popped in. Do you find there's less efficacy with those who need higher doses of injectable semaglutide? I have a decent amount of patients who are on approximately 1.75 milligrams weekly.
That is not published. It's not published that there is less efficacy. So I'm going to say no. But like you said, 1.75 is also a decent dose, right, on semaglutide. So I think it's something that you're going to realize or, figure as you do it. But the truth is, no, we don't see that there's less efficacy. I do feel like when people get on the higher doses, though, sometimes it becomes a little bit of a mental thing. They're like, okay, I don't want to work. I'm going to increase my dose. And so sometimes it's about kind of redirecting the patient and making sure that the medicine's working, but they're not overeating it. We all have that one patient. If you've been doing this long enough that it's like, you need to pay more attention in your brain, because you're letting your habits. I don't think my dad's online here, but if, my dad is like the worst example. He likes food. It's his hobby, we call it. He likes to go out to eat, and so he's not a good candidate for weight loss medicine, because it's what he does. He does it for fun. He doesn't do it for hunger or anything like that. And he's very set in his ways. I love you, Daddy. But anyway, he's set in his ways. And this is, I feel like sometimes you have to get in the head of people. Also the people that have said, I've been dieting forever. I only eat 800 calories a day. I never lose weight. Those people are going to be a tough one, right? They're the people that they're telling you from the get-go, you're not going to be able to do this. And so, I love a challenge like that. And I do think I can do it. I have my own way, and that's not really what this is about, but I'm happy to share kind of the techniques that I use on patients like that with you afterwards. If we can, I can share my email or phone number. But, there's always those people, but I'm telling you what, like with experience, I feel like I can budge them too. It's just about understanding their mind and kind of helping them kind of rein it back in and put it into the right perspective, and I don't like to make prescriptions at all. And, pharmacy prescribing medications, it is a whole nother ballgame. When we're sending people home with it, I think it's important that we don't act cavalier about this. Just because everybody's doing semaglutide doesn't mean that we don't need to do it well, And so I do feel like it's very important that you collect this data, but you do it with your patients, stay in close contact. We're not really just doing telehealth and mailing them medicine. We're helping them lose weight, right? We're not just selling medicine. We want them to be successful. We want good reviews, and we want them, honestly, I want them to lose weight. I don't want to sell weight loss medicine to somebody that feels hopeless and just walk away, So I have a lot of tips and tricks to kind of get over that kind of patient, the patient that I feel like maybe it's become a mental game as much as a dose game. It's like, don't just keep clicking your pen.
Another great question, and I'm going to add to it as well, because I've been asked these questions, but for Meredith, how important is it to obtain an obesity medicine certification, or what education do you suggest to someone getting started with weight loss medicine?
I think that's a great question. I actually did go to, when I got trained, and I did training in medical weight loss. I don't even remember why. I think just because I found it fascinating, but I did get trained in it. If you are a PA, a nurse practitioner, a DO, an MD, it's in your scope, right? It's in your scope. Or I guess nurse practitioners, the different types maybe matter a little bit. But as long as it's something in your scope, then I feel like you should determine how much education you need. If you aren't 100% confident on how the body works, on how weight loss works, on how plateaus, set points, cravings, hunger, satiety, serotonin, all of that, I would say get educated, because I feel like that's kind of the onus on us. We should not sell prescription medicines if we're not 100% confident in how they work and, how safe they are, or how to help select for your patient, So I do think that if you feel the best way to learn about this is to get an obesity certification or attend a course, absolutely 100%. But is it required? No. If it's in the scope of your degree, if you have prescriptive authority and it's in your scope, then no, it's not really required. Just like it's not required to go get a blood pressure certificate or a diabetes one before you work in diabetes, And I'm speaking as a PA. If I am incorrect on the nurse practitioner scope, I apologize. But as far as requirements for a medical provider to have a special one for obesity, that's not the case. And they didn't make a special rule for medical spas either.
And then I get a question regularly, Bridget, from practices that are curious as to whether or not they should get a blood panel from their patients prior to starting any kind of weight loss program. I'm curious to hear your thoughts.
I will tell you my thoughts. Okay, here's my thing, because my background as far as PA in medicine, I was a hospitalist and ER. So I was a victim to 1,000 D-dimers that should never have been ordered, or lactates. If you were around during the sepsis craze, ordering labs that you're not going to necessarily need puts you at a risk, right? Because now if that lab's abnormal, you have to follow it up. So do you need lab work to prescribe a GLP-1? No, you don't. You do not need lab work. You need a weight, maybe a blood pressure. You actually don't even have to have the blood pressure. You need the weight, and you really need that so that you can follow the patient's journey, but you don't need labs. I do not order labs. I'm not telling you what to do, but I am cautioning you, if you order labs, be prepared. If you're going to order a CBC to put somebody on semaglutide, number one, why? And number two, what are you going to do? What are you going to do if it comes back with an elevated white count or a little anemia, and you're the last person that saw them? If you're collecting the data, you have to be prepared to follow up on it, right? You would be negligent if you got, you know, an anemic profile or somebody with acute kidney injury and you didn't follow it up. So to me, I'm like, should we order a BMP, CMP? I don't think so. Should we order, you know, a CBC? I don't think so. But that's because I don't do any medicine. I do weight loss and aesthetics, you know, but I don't do medicine. Now, a lot of these spas may be people that are working with hormones or peptides or something like that, and they're going to have labs. That's a different case. To answer the question, for this medication, do I need labs? The answer is no. And for my personal opinion, I wouldn't collect them unless you have the manpower to follow up on it. You know, be prepared to get a CBC with an elevated white count or something, you know, and then what? What are you going to say? Oh, you might be sick, but here's your medicine. You know, just, I would say, ask yourself, what am I going to do with the results? But the answer is you don't have to have it for this. That's
great. Thanks, Bridget. If there are any other questions, type them now or forever hold your peace. This has been really, really helpful, Bridget. Thank you so much for taking the time, not only for the presentation, but for answering all of our attendees' questions. This was really great engagement too, because some of these questions, this is the first I've heard of them as well. If any of you do have additional, we've got one more we'll answer. I think we've got time for one more question. How many days supply is dispensed to the patient at a time? What is the follow-up schedule once on the medication?
You can dispense either a month at a time, or you can do a 90-day fill. The 90-day will be a little bit less cost to you. You know, how you price it is up to you, but the 90-day supply is a little bit less expensive, but you can also do 1 month at a time. You can do 30 days or 30, 60, 90.
And the follow-up schedule once they're on the medication, how do you typically organize that, Bridget?
I tell people I want to hear from them at least once a month, but anytime they have a question or a side effect, to reach out to me. I am of the opinion that as the provider, I would rather, you know, because now we're kind of crossing over to the realm of like, should I do with my PCP or should I do it with my med spa, you know? And it's kind of an interesting question. But once I have that client, I really don't want them asking somebody else questions. I don't want them going to their GP and saying, oh, I've got nausea and stomach upset. What should I do? And their GP is like, where'd you get this semaglutide? You know, why did Jungle Jim's pharmacy send this? You know, and then it gets like this bad rap and the doctor's like, who's stepping on my thing? You know? So to me, I want them to come to me with the follow-up. So I tell people when I'm coaching them, I say, I want to hear from you at least once a month, because that's how often that we could typically change the dose. But I also want to hear from you absolutely sooner if you have any side effects, if you have any questions, if you know, if your cat got hit by a car and you're worried it's a side effect of your semaglutide, I want you to ask me that. You know, I want to be the one to say, because not only do I feel like I'm able to answer their questions, and I don't want them to going to somebody else who might say something that's not correct, right? A lot of people don't prescribe this and they have an opinion that may or may not be this, you know, the same information that we have, and it may not be the fact. I want them to come to me, but also I want to help them, you know, if they're stalling or if they're going too fast. I want to be able to say, oh, this is, you know, you're now in an outlier category. I want to fix it. I want to help you. I absolutely love helping people lose weight, but I love the good feedback, because then it makes me better. I can say, oh, I had a client who said that. You know, if I'm not asking for the feedback and for the side effects and the, you know, the results, it's harder to help. You know, it's harder to help others. But I can say, oh, you know, I've done this with thousands of ladies and men. And, you know, I did have somebody say she thought it gave her headaches, but there is zero data that says a headache is a side effect, you know, and that's stuff our pharmacists that we have on hand can help us with. Anytime you get questions like that, I always say, go to the source, find it, you know, find the study, get the information. I don't want anybody going to their PCP and saying I have a headache before I knew about it. You know, while they're under my acute management, I like them to follow up with me. So I give people my personal information and I make sure that they contact me once a month, even if they even have the 90-day supply.
Bridget, again, this has been fantastic. Thank you so much for joining us today. We've gotten some thank yous in the chat to you. And I know some of these folks would love to speak with you directly. We will put you in touch if you've requested to talk with Bridget. And thank you so much for everybody for staying with us. I think Bridget mentioned it very early on, but I am going to say it one more time before we go. If you are interested in learning more about this, we have some great account managers at MedShift. They know a lot about this program, but of course, we've got wonderful people like Bridget on hand to answer some clinical questions if you have them. And then you can always go to our site. There's an offer here on the right side of your screen. You can click the button to, quote, get started, and you can see a little bit more about the semaglutide options and program that we have on our MedShift store. So Thank you again to everybody. Have a wonderful evening, and we look forward to seeing you on our next presentation.
Thank you.
Thank you. Bye-bye.
Bye.